Hey guys, I'm Dr. Moore with Cumberland Chiropractic and Sports Medicine. Today I'm going to be talking to you about knee pain and some easy things that you can do at home if you're someone who suffers with it. So stick around. Okay, so again today we're talking about knee pain. Now not everyone knows that chiropractors help people with knee pain, but it's something that we see in our office every day. Now people who work with treating knee pain, there's a common saying that we like to throw around, and that's that the knee is the slave to the ankle and the hip. Now why do we say that? That's because the knee joint is classified as a hinge joint. Just like a hinge that just opens and closes, that's primarily the knee's job. Sometimes it shifts around a little bit, but for the most part, its job is to extend and to flex. But its co-workers, the hip and the ankle, the two guys that it has to work with to get us around every day, these joints are more complex. They twist, bend, extend, pronate, supinate, all these different motions that the hip and the ankle does. And if they don't do their job well, then the person who pays for it, or the thing that pays for it, is your knee, because it can't really accommodate for those bad motions from the ankle or from the hip. So that is kind of the premise for what we're going to be talking about today. A good way to reduce wear and tear knee pain, not knee pain that you get from maybe a fall or a sports injury or a weightlifting injury, but if it's just chronic wear and tear that's leading to generalized joint pain in your knee, if we can get better motion into your hip and your ankle, we're going to take a lot of strain off the knee joint. Okay, so when we're working with knee pain in our office and we're looking for hip or ankle problems leading to that, we have specific tests that we like to use to kind of hone in on what the patient needs. But that's not what this video is about. This is about helping you at home what the majority of people need. And the majority of people in our society have stiff ankles and hips. They don't have good range of motion, and that can chew up the knee. So I'm going to tell you about 4 stretches for the hip and the ankle that I like to prescribe for people with knee pain. One is called a baby feet stretch, and the other is called a heel lowering stretch for the ankle. And for the hip, I like to prescribe something called a figure 4 stretch and a hip flexor stretch. These will essentially loosen up the most common range of motion restrictions in those areas and take less strain off the knee. Now, the other problem with the hip that's pretty common that can lead to knee pain is poor control, or like a sloppy hip. For this, what I like to do is prescribe exercises to start to train muscles in the hip that give you better control and will take some of the strain off the knee. Those exercises are pretty simple. They're called a glute bridge and a clam exercise. I'm going to provide the links for all of these stretches and exercises in the description of the video. So what I would do is I would take these stretches and exercises. You know, if the stretches feel tough to get into those positions, that's a good way of kind of knowing I do have a problem here. It doesn't look as easy as it does in that video. And I would do these for a period of time, probably a week or two. If, you know, after about 2 weeks you start to notice that you have less knee pain, then that's a good way of kind of knowing, hey, my knee is kind of hurting because I've got a problem in this chain of motion up my leg. The ankle, knee, hip, they're not working together, and that will help with the majority of wear and tear knee pain. Okay guys, so we're gonna leave it there today. I hope you enjoyed the video, and I hope these stretches and exercises help with your knee pain. So a small disclaimer, this strategy won't work for all forms of knee pain. Kind of like what I said in the beginning of the video, there are very many causes for knee pain. So this kind of helps with wear and tear knee pain. But if you try these and you're still struggling with knee pain, or there's a portion of your knee pain left, then why don't you give us a call? We help people with knee pain every day, something we love to do. So until next time, this has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better, faster.